Welcome to the Mindfulness program for stroke survivors and family caregivers. You will be introduced to the concept of mindfulness to help manage any stress that comes with having a stroke or as a caregiver, and we hope this will help to reduce the risk of having another stroke. To be mindful is to choose to pay attention to your internal and external experiences, such as your thoughts, emotions, bodily sensations, and your interactions with others and your environment that are happening in the present moment. Observe these experiences with kindness, curiosity, and without being judgmental. Simply notice the experience without trying to determine if it is good or bad, and not to be hard on ourselves for the experience. We need to practice being mindful on a daily basis. For stroke survivors, also ensure that you shift your attention to both the left and right parts of your body. You are encouraged to practice daily for a minimum of 15 minutes. Do consult your doctor before attempting the exercises. For the first practice, we are going to pay attention to our breathing. Take a slow, deep breath. Bring your attention there and notice the feeling of breathing naturally. Now that you have located your breath, notice the feeling of breathing in and out naturally, without trying to change how you breathe. With both feet firmly on the floor, sit comfortably and as upright as possible. Gently close your eyes and focus only on the feeling of breathing. It is normal if you notice that your attention has wandered away from your breath. Allow yourself to note the distraction and then let it be, and gently return the attention to the feeling at your nose or your body as you breathe in and out. Gently return your attention to your breath where you find it most easily. Now, slowly bring your attention to the feeling of your feet on the floor. Bring your attention back into this room, and when you are ready, gently open your eyes. Practicing being mindful on a daily basis helps to train the brain to notice when we are distracted and bring our attention back to our object of interest and sustaining our focus on this object. For the next exercise, we are going to be practicing mindfulness of the senses. We are going to be more aware of the physical sensations surrounding us. Sit comfortably, as upright as possible, with both feet firmly on the floor. Start by taking a deep breath and allowing the breath to flow into its natural rhythm. Now, close your eyes so you can focus only on the feeling of breathing in and out. Notice the sensations that accompany your sense of touch, such as the feeling of your feet on the floor, your body in the chair, the clothes that you are wearing, even the air against your skin. Without judging the experience, notice the qualities of these objects in contact through your sense of touch. Gently focus your attention to your sense of hearing. Slowly observe all the sounds that are around you. Simply observe the qualities of the sounds. Now bring your awareness to your sense of smell. As you breathe in Observe the qualities of these smells. Slowly bring your attention back to your breath, allowing yourself to feel the air as it enters and leaves. Gently return your attention to the room, and when you are ready, you may open your eyes. We are going to begin the body scan exercise. It is an important exercise for bringing awareness to the body and its individual body parts. Let's pay attention to different parts of the body. We may notice sensations that may either be pleasant or unpleasant, or we may notice no sensations. Observe them and try not to alter or change them. Let go of that part of the body and bring your attention to the next part of the body. While doing this, you may observe and experience unpleasant sensations such as tension or pain. You may stay with the tension or pain and observe the experience. If it is overwhelming, return your attention to your breath and pay attention to the sensation of the in-breath and out-breath. Sit or lie down on your back in a comfortable position, with feet and arms slightly apart from the body, and gently close your eyes. Bring all your attention to your feet. Notice what your feet feel like. Gently move your attention slowly up your legs to your knees. Now move your attention to your thighs and hips. Bring your attention now to your lower back. Allow yourself to notice whatever sensations may be present in your lower back at this moment of time. If you notice tension or pain, you may wish to breathe into this area of your body without moving your attention away from it. If the experience is unbearable, you may choose to bring your attention to the feeling of breathing. Move your attention upwards towards your upper back. Bring your attention now to the front of your body and notice how your stomach is feeling. Feel the sensations in your stomach as you breathe in and out. Slowly, notice the sensations that may be present in and around your chest area. Shift your attention to your shoulders. Move your attention down your upper arms from your shoulders towards your elbows. Now slowly move your attention down your lower arms from your elbows towards your wrists. Notice your hands, the back of your hands, the palm of your hands, your thumbs, and all your fingers. Slowly return your attention to your shoulders and note the sensations. Feel the back and front of your neck. Gently shift your focus from your neck to the bottom of your head. And slowly move towards the top of your head. When you have paid attention to each individual body part, breathe a few deep, relaxing breaths. When you are ready, gently open your eyes. For stroke survivors, we may find that our body does not feel or behave like it did before we had the stroke. Research has shown that doing exercises like the body scan practice helps improve the sensation and motor function of the different parts of the body. Now, we are going to learn how to bring attention to different parts of our body while it is in motion. There are 10 movements in total. Do each movement slowly and for 3 times. Do pay attention to the sensation to the different parts of your body as you move. If there are movements you are not able to do, you can still think about the movement in your mind or ask someone to assist you with it. Only move your body within your available range and not push yourself beyond. You should not feel intolerable pain during the movement. Do take a break in between if you feel tired, and stop if you experience dizziness or pain. Remember, the focus is on bringing awareness to your body as you go through the movement. 1. Starting position. Please ensure that you are sitting on a stable chair that you normally sit on. Sit with your feet shoulder-width apart and make sure that your feet are firmly placed on the floor. Otherwise, you may shift forwards in your chair. Feel it as if a string is pulling you up from the center of your head and sit tall. Now feel the ground that is in contact with your feet and your buttocks. Are they even? Where is the center of your mass? 2. Drawing circles with your feet. Sit tall. Put your right foot forward. Draw circles with your right foot slowly in a clockwise direction 3 times. Pay attention to the muscles working around the ankle. Now draw circles in the opposite direction. Does it feel different in the opposite direction? Now place your left foot forward. Draw circles with your left foot in the clockwise direction 3 times. Now draw circles in the opposite direction. Pay attention to the ankle joint. Does it feel different between the left and right? 3. Sitting forward bend. Do not do this movement if you experience dizziness or discomfort with bending forwards. Sit tall in your chair. Ensure feet are firmly placed on the ground. Tuck your chin in and bend forwards from your upper back, middle back, lower back, and eventually reaching your toes. Stay in the position and pay attention to the sensation from your neck down to the tailbone. Now return back to upright, extending from your lower back, middle back, upper back, and eventually your neck and upright position. Tuck your chin in and curl your body forwards. As you do so, pay attention to the bones in your spine as they start to bend forwards, one on top of another. Repeat it one more time. Tuck your chin in and curl your body forwards. As you do so, pay attention to the bones in your spine as they start to bend forwards, one on top of another. 4. Sitting trunk twist. Sit tall in your chair. Put your arms to the right side of the armrest. You may hold onto the seat of the chair if your chair does not have an armrest. Turn your head to the right and twist your body towards the right side. Aim to look behind. Stay in the position and pay attention to the tension in your body. Return to starting position. Sit tall, turn and look behind. Return to starting position. Sit tall, turn and look behind. Pay attention to how far you can turn now. Is it more than earlier on? Return to starting position. Put your arms to the left side of the armrest. You may hold onto the seat of the chair if your chair does not have an armrest. Turn your head to the left and twist your body towards the left side. Aim to look behind. Stay in the position and pay attention to the tension in your body. Return to starting position. Sit tall, turn and look behind. Return to starting position. Sit tall, turn and look behind. Pay attention to the tension in your body during the movement and in the position. Does it feel the same as the other side? 5. Sitting pelvic tilts. Sit tall in your chair. Rock your pelvis forward. Imagine your pelvis is like a bowl. Tip your pelvis forward as if you want to empty the bowl. Stay in the position and pay attention to the muscles required to keep you in the position and the area in contact with the chair. Rock your pelvis backwards as if you want to empty the bowl backwards. Stay in position and pay attention to the muscles required to keep you in the position and the area in contact with the chair. Do it 3 times. Rock your pelvis forwards and backwards slowly. Rock your pelvis forward. Pay attention to how your weight shifts forward and backward on the shifting surface and the tension or muscles working to keep you in the position. Is there a difference between moving forward or backwards? Six, shoulder rolls. Sit tall. Roll your right shoulder up and backwards in a circular motion. Do it 3 times. Pay attention to how your muscles around the shoulder need to work to control the movement. Now move your shoulder in the other direction, up and forward slowly. Pay attention to how easy or difficult it is to move your shoulder in the opposite direction. Pay attention to the shoulder joint and the area around it as you move. Now let's move to the left shoulder. Move your left shoulder up and backwards slowly. Pay attention to how much you can move. Is it different from the other side? Now change direction. Move your shoulder up and forwards. Seven, Neck side bend. Sit tall in your chair. Tilt your head towards your right shoulder. Stay in the position and pay attention to the tension or sensation at the side of your neck. Return to starting position. Do it 3 times. Tilt your head to your right as far as you can, and back. Pay attention to how far you can tilt your head to the right. Now let's tilt your head to the left side. Pay attention to the tension or sensation around the neck area. Do they feel the same for both sides? Tilt your head to the left. Return to center. And now one more time. You will need a stable surface to hold on to for stability during the movement in standing. Proceed with the next set of movements only if you are able to stand without support for at least 30 seconds, or if you have a caregiver assisting you. 8. Rocking feet. Hold on to a chair for support. If you have your caregiver with you, your caregiver will stand on your affected side. Rock your feet backwards onto the heels of your feet, slowly, without falling. Rock your feet forwards and tiptoe slowly. Do it 3 times. Pay attention to the area in contact with the ground as you rock your feet forwards and backwards, and also the muscles that have to work to help you to get into the position. 9. Lateral weight shifting. Hold onto a chair for support. Shift your weight onto the right leg. Now shift your weight from the right leg to the left leg. Stay in the position and pay attention to the muscles working to support you in the position. Now shift to the right again, and then back to the left side. Repeat once more, and pay attention to how your weight shifts from one side to the other. Is there any difference between each side? 10. Standing and stepping. Hold onto a chair for support. Place your right foot 1 step in front. Shift your weight from the left leg behind to the right leg in front. Stay in the position and pay attention to the muscles working to support you in the position. Shift your weight from the right leg back to the left leg. Repeat it again. Pay attention to how your weight shifts from one leg to another diagonally. Bring your right foot back to the starting position. Now bring your left leg forwards. Shift your weight from the right leg to the left leg in front and back. Now repeat again. Pay attention to the area in contact with the ground as you shift your weight from one leg to another, and also the muscles that have to work to help you get into the position. We hope this has been beneficial for you. Remember to consistently practice mindfulness for better physical and mental health. Happy mind, healthy life. Take care.